I'm Joe Halco, your host, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being for the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance with emotional and behavioral challenges, their mental health, substance use, or an intellectual or developmental disability. May is Mental Health Awareness Month, a time to acknowledge the importance of emotional well-being and to remind people that help and hope are available. For those struggling with their mental health, know that you're not alone. Here's some statistics to support that statement. 1 in 5 U.S. adults experience mental health challenges each year. 1 in 20 U.S. adults experience serious mental illness each year. 1 in 6 U.S. youth have a mental health condition, but only half receive treatment. 50% of all lifetime mental health disorders begin by the age of 14 and 75% by the age of 24. And in 2023, 20% of all high school students seriously considered suicide. To discuss the importance of your mental health, I'm pleased to introduce this month's guest, Dr. Harris Strokoff, the medical director of NCSS. And Dr. Strokoff, I'd like to welcome you to the program. It's great to have you back. And let's start with, how do you define mental health and well-being?
Yeah, thank you. Yeah, so there are lots of different ways to define mental health and well-being. Essentially what mental health is it's all aspects of health that are not kind of purely body physical, and what I think of is emotional health, psychological health, our thoughts, and social health. And really, it's also I've seen it described as the absence of basically thoughts, feelings, or behaviors that get in the way of functioning at our best and get in the way of well-being, which is what it sounds like, in my mind, a state of feeling good and feeling capable to deal with difficult things.
Yeah. So, what changes have you seen in how people talk about or seek help for mental health compared to even a decade ago?
Yeah. Well, a lot. Even a decade ago, there were some positive changes as far as people not feeling overly constrained to talk about mental health, to talk about struggling with things like depression, anxiety, ADHD, et cetera. And I'd say now compared to 10 years ago, it's even a more positive environment to talk about one's own mental health struggles, which let's face it, we all struggle at times, and being able to talk about it and seek help it's huge. It's really useful to be able to combat these impediments, and certainly these days, especially amongst younger people, people are talking about mental health more, seeking ways to improve their own mental health, and it's certainly helping a lot of people.
Absolutely. And that's one of the things that in looking at data over time, that I find intriguing is the fact that the older someone is, the more that stigma kind of plays a role in seeking help. It's kind of like, in my parents' day, no one would utter anything about mental health. I mean, if you had a family member that was struggling or what have you, it was almost like shunned upon. When in reality, they should have been supportive, and so the one thing that you've mentioned that I think is really encouraging is it seems like the younger an individual is, the more willing they are to understand, number one, they're struggling with something, but number two, to talk to somebody about it, try to find trusted sources, and seek help a lot sooner than individuals used to. So with what you've uttered is I totally am excited by the fact that the younger somebody is, the more willing they are to understand that, hey, this is just part of life. It's like if they were a diabetic or they had a heart condition, they would talk about that. They'd seek treatment. Same thing with mental health. The brain is so complex that I get excited just by knowing that people don't have that wall of stigma that's impeding them from getting treatment and help. So how does mental health affect our day-to-day functioning, relationships, work, and decision-making?
It affects it immensely. When our mental health is good, we feel more empowered to make decisions that are best for ourselves, that are best for our family, our community, and and alternatively, when we're struggling with things like depression or anxiety, our mind may go to a negative outcome before a positive outcome more frequently than is useful. And it can actually, one thing I see a lot of is it can negatively impact one's propensity to take what I call like healthy risks. I'll go outside and maybe, say you're a child, I'll go outside and maybe see if anyone's kicking the soccer ball around.
Yeah.
With depression and anxiety, it might be, no one's going to be there, no one's going to want to play with me, I'm no good at soccer. But by taking those healthy risks, then eventually you end up meeting people and maybe picking up a healthy hobby, etc.
Yeah, so true. So looking at stress and anxiety, which are incredibly common, when do they become problematic, and what are some of the coping strategies for that?
That's a great question. So we all deal with stress and anxiety. That's literally part of the human condition, and it's pathological not to have feelings of stress and anxiety. And stress and anxiety they're valuable. They prevent us from taking unhealthy risks. They prevent us from being in danger. They prevent our family and others from being in danger as well. And when it becomes too much, if it starts to impair us, if it starts to maybe get in the way of our ability to think, when we need to focus on something, our ability to socialize when there's an opportunity to do so. It can impact our physical health for sure if we engage in problem drinking or problem eating or problem substance use as a result of stress and anxiety.
Yes.
It can sometimes stress and anxiety can impact one's physical activity. People may find that they spend so much time worrying, they spend less time doing, and they're not as active. So in many ways, it can negatively impact us.
Yeah, and this whole thing about the physical relationship is, we talk about your mental health is as important as your physical health, and you need to have that balance. But I think a lot of times people think if from a physical standpoint things seem to be going well, the whole mental thing doesn't matter. And certainly, as you've mentioned, it does matter, and it does have an impact, on one's living their best life. So,
yeah, it's our physical health and our mental health are more intertwined than we'll ever know. And you really can't have one without the other. Even anyone who's gone through a major surgery or has struggled with severe physical issues, it's impossible for that not to impact us mentally, emotionally, socially, and vice versa. It's really difficult. One may, when going through, let's say, a very severe depressive episode or struggling with anxiety, maybe they can look okay physically, look physically healthy, but oftentimes it may increase their blood pressure, which can lead to physical issues or lead to other body inflammation. So mental health and physical health are very much related, and it's near impossible to improve one without trying to improve the other.
Yeah, that's a great point. So What mental health challenges are you seeing most often among children and adolescents today?
Well, I'd say most often it's probably anxiety and depression. Certainly attention deficit issues as well. And those are the three most common conditions in kids. They always have been. I'd say all three of those are more pronounced now than they were 10 years and 20 years ago, due to a variety of reasons. For one, just societal changes. Another certainly is impacted by COVID. Kids going through developmental stages without as much socialization, physical activity, and learning as they typically had. And also, the fact that so many humans today spend so much of their lives on devices that are not the same as having real social interactions. That certainly negatively impacts one's ability to sustain attention, as well as a worsening of anxiety and depression.
Yeah, and speaking of devices and all of that, how are social media, gaming, and the constant connectivity impacting youth mental health?
Largely negatively, in my opinion. I mean, certainly there's positive
Absolutely.
impacts.
Yeah.
The ability to not feel alone if you have certain interests that maybe other people in your community don't have. Being able to connect with family or other associates from afar. So it certainly can be positive. But on balance, we know that kids and adults that spend the most time on social media, the studies show they're the least social, and so they're
yes.
the least. They're not having true, authentic social interactions at the same rate as they did before, and that correlates with increasing depression, loneliness, anxiety, etc. Not to mention that social media companies, by and large, they're interested in making money, like most industries, and just like cable news, negative news gets more eyeballs. Negative news gets more people to pay attention, and social media companies, tend to put images, videos in front of whoever is consuming it that will, more than anything else, get people to continue to engage in that social media. And oftentimes that's negative content or content that might seem positive but really makes someone longing or wanting for something that is unnatural, which can then also worsen mental health. Fear of missing out is another thing that's big with kids and adolescents. That is not nearly as profound without pictures, videos, and so forth on social media.
Yeah, very, very difficult. So as a society, once again, we've never been more connected than we are now, and we've touched upon it, but even though we are connected, this whole situation about loneliness and isolation has been on the rise. Is there a way that we can try to address this so that it kind of breaks that mold for people?
There is, and it's happening. For instance, in the state of Vermont, and I think in most states by now, cell phones are no longer in schools. There was luckily it was a brief period, but there was a period in time where it was the norm in study halls and lunch breaks for every kid to be like this. And then obviously that doesn't help anyone feel less alone. And that's really the opposite of one of the best strengths of what school is, and that's finding community, finding oneself amongst others. And so since Vermont has taken the steps to make it so there are no longer phones in school, kids are talking with each other more. Kids are engaging with each other more, playing with each other more, which can certainly help combat the loneliness epidemic, if you will. There's a term that I've been using a lot lately. It's called third spaces. In other words, we think about for an adult, it's work and home. For a kid, it's home and school. The third spaces are, well, what else is there outside of that where we can physically be? And that can be after school programs, that can be clubs, that can be sports, that can be being part of a music group, that can be church. I think investing in these third spaces is also really critical, because some people find that sense of community at school and at home, but most people also need more than that. And with COVID, and also with the fact that so many people are spending their lives on devices, there's just less people involved in these spaces. And there's really been, it's been heartening to see amongst all ages, more of these third spaces come together in recent years.
Yeah, that's very interesting and so needed and necessary. And, something else that falls into that category is people that volunteer. Because volunteering has always been something that everybody's not been interested in. However, one of the things that I've noticed over the last year or so is that there are more individuals who are at least considering volunteering in some facet. And there's so many different ways and organizations to volunteer for. Everything from camps to organizations where you're doing something weekly or monthly. But that can, to your point, break this whole isolation, loneliness scenario. You're meeting people, you're socializing, getting off your devices, per se, and hopefully making a positive difference. The other thing about that is that it's been found that although you're helping someone in some fashion by volunteering, what you really get back is even greater, and that's the fact of how people are very appreciative of the work that you're doing. So here again, you're trying to break that mold of loneliness and isolation, as well as people are not just spending time on devices.
You're absolutely right. There have been countless studies that show that people that volunteer, help people out, it is positive for that person's mental health. And I'm not going to pretend to understand the exact mechanism biochemically. There's a lot we don't know in our field, but it's certainly true. And it kind of goes along with socialization, being a good citizen, being a good neighbor. When you think about it, these are things that have been critical for as long as humans have been humans. Being able to get along with your group, being able to be useful in your group, going back to cave person times. And anything that tends to be useful tends to elicit our body to feel good via dopamine or serotonin, what have you. And the absence of doing that, and same with physical activity. Physical activity is useful, for as long as we've been humans, and that's why we get the good neurotransmitters from doing so. And anytime, humans kind of break away from doing those things, you don't get those neurotransmitters, and that can certainly lead to or worsen depression, anxiety, etc. So as you just mentioned perfectly, volunteering literally does make us feel better, and so it's really great that there's been coming out of COVID more and more of that in our society.
Yeah, and I think again, it's one of those things that people don't really think about all those elements and aspects, but once they get immersed in it, they begin to feel a bit differently, as you say, which is a great thing. And it is so necessary for so many organizations to be sustainable as well, that people are willing to volunteer and help out. So let's get back to the S word, stigma, which, still exists without question. But, due to stigma, many people hesitate to ask for help. And what would you say to someone who's unsure or afraid in an effort to try to get them to seek the help and the treatment but that they need to feel better?
I would say that, we as humans, we all struggle, and we're in this together. And we as humans, we all need help, whether it's help with our blood sugar, help with our depression, help with our needing a knee replacement. We all need help, and we don't always get to choose what type of help we need. But much like any of those other conditions I mentioned, most of the time, the sooner that we find out what's happening with us and engage in treatment, the sooner we can feel better, and the less kind of negative cycles can proliferate that can then make it harder to feel better. So that's what I would say.
Yeah, and that, the studies that show people sometimes wait like 5 years or 10 years before they actually seek treatment. And you think about, that's time goes fast, yes, but that is a long time not to seek treatment. I mean, that would be like if you or I went out and we broke our arm this afternoon. We're not going to just say, well, we don't want to get this resolved, repaired, and delay it as much as possible. But yet, when it comes to mental health, people, many people, just refuse to accept the fact that there's treatment available, there is help, and that they'll feel better. For whatever reason, again, stigma, I realize, is the main barrier. But in a perfect world, as you said, people would want to try to seek the treatment as soon as possible to try to correct this. It makes it a lot easier because you're not so far down the road, so to speak, of depression or anxiety. And as you said earlier, Doctor, we all deal. I mean, you need in your life to have a little bit of anxiety because I think that keeps people sharp going into situations, circumstances. But it's when it overtakes your life where that becomes a challenge mentally. But so if someone who is watching or listening to us today could take just one step towards better mental health, what would you recommend that they do?
I would say it's being with other people, being with other positive people. And if you feel like you don't have positive people that you can talk to, finding them and finding them in a third space, if you will, getting help. Talking to a therapist. The great thing about psychotherapy is that there's unlike medication, there's no possible side effects really. Sure, it can be like taking out a splinter. It can be hard at first, but it helps us feel better oftentimes the rest of our lives. And so really, not knowing that, my advice would be knowing that we're not alone. And by talking to others, then we oftentimes realize that, okay, this is something that a very high percentage of humans struggle with. There are treatments available. There are things we can do. And even to get out of the clinical realm, it may not be a treatment, but there are activities we can do. There are new paths we can take in our lives that can help bring meaning back into focus and help us feel better.
You make a good point as well. I think it's important that we touch on medication because so often you talk to somebody and they think, well, to relieve depression or whatever, I'm going to take a magic pill and that's going to be the answer. And I think it's so important that people realize, and especially here at NCSS, that the last part of the regimen would be to add some sort of medication, that the treatment is really the number one way to try to solve something. And in some instances, people may need to have some medication as well, but that is not the rationale or purpose of having a mental health clinic is for medications, that's kind of like the last resort, and that the importance of therapy. So if you could just kind of touch upon that, because I think sometimes that gets misunderstood by people who maybe are going to finally say, I'm going to seek some treatment, but I know that's going to mean meds and all that sort of thing.
Absolutely. So medications for certain conditions are truly life-saving, and they literally may be one of the key things to the key things that basically differentiate between really suffering and being able to live well. And medications, when they're not 100% necessary, can sometimes cause more side effects than benefit. And so so there's that. And then also, to get back to the first question you asked, what is mental health? Mm-hmm. It makes me think about, three things, and those are thoughts, feelings, and behaviors. Medication tends to be best at helping with feelings, but without really addressing the thoughts that tend to underline what's going on, and the behaviors, which are how we deal with mm-hmm. the thoughts and feelings, it's really hard to get anywhere. 90% of the time, if not more than that, I recommend psychotherapy and lifestyle changes before medication. Again, there are certain conditions where the medication is crucial sure. from the get-go. Sure. But a lot of the time, medication is not necessary. As a psychiatrist, when medication is necessary, I'm always talking to my patients and looking for opportunities to see when the medication may not be necessary, again, in cases where it may not need to be a lifetime medication.
Well, and the other thing that you mentioned too, and the beauty of that is the fact that you don't have to deal with side effects, so, mm-hmm. and that's big because I know there's usually a laundry list of what potential side effects can be from certain medications, but depending on a person's disposition, there may be some really critical things that it impacts in their life. So maybe they're feeling a little better on one hand, but it's destroying their body on another hand. So I think you make a good point about, if you can, trying to avoid the medications being a part of the regimen, and therefore at least eliminating some of those side effects or potential side effects.
Absolutely. It's only worth being on a psychiatric medication, if it's a complete game changer, mm-hmm. and if the potential benefits outweigh the potential risks. And especially when I think about there's different levels to everything, but for let's say kind of the average or lower level anxiety or depression, psychotherapy can be immensely helpful, and a lot of times that's all that's necessary. There's a reason that that pharmaceutical companies aren't publishing studies showing how their medication stands up against diet and outdoor exercise. Mm-hmm. It's because it doesn't. And so there's many other in socialization. There's so many lifestyle things that also can help. And by working with a good therapist, talking to your doctor about it, oftentimes they will steer you in the direction of the non-medication treatments that can be really helpful. And then if medication is needed, we're lucky enough in our society to have access to professionals that can help with that as well.
Yeah, and I think once again, it's critically important that people understand that at NCSS, really everybody is here for them to try to help them live their best life, and that doesn't necessarily mean it needs to include medication. So I just thought it's important that you share that information with people, because there are those who think, well, you can't do it without it, and that's not always true.
Definitely.
Well, Doctor, I can't believe our time's up already, but I do want to thank my guest, Dr. Harris Strokoff, for sharing his insights on the importance of mental health in achieving well-being and living your life to the fullest. I also want to thank our viewers and listeners for spending time with us again this month. You can learn more about all of our programs and services by logging on to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.